Welcome to Wally's Nursing Videos. Today's lecture will cover nursing considerations across various medical surgical health conditions. Inflammation, infection, and perioperative. Inflammation and infection. Causes: microbial invasion, trauma, foreign bodies. Signs and symptoms: redness, swelling, heat, pain, loss of function. Systemic signs in infection: fever, malaise. Nursing interventions: administer antibiotics, monitor vital signs, provide wound care, educate on hygiene. Sepsis post-surgical care. Causes: infection, systemic inflammatory response. Signs and symptoms: fever, hypotension, altered mental status. Nursing interventions: administer antibiotics promptly, monitor labs, fluid resuscitation, support vital functions. Skills PCA, patient-controlled analgesia. Causes: postoperative pain management. Signs and symptoms: pain assessment, respiratory depression. Nursing interventions: educate on PCA use, monitor for adverse effects, assess pain levels regularly. Septic shock. Causes: uncontrolled infection leading to systemic vasodilation. Signs and symptoms: hypotension, altered mental status, organ dysfunction. Nursing interventions: administer antibiotics, vasopressors, fluid resuscitation, monitor for complications. Immunity and musculoskeletal. HIV, lupus, hip replacement, and traction. Causes: viral infection, autoimmune response, joint degeneration. Signs and symptoms: immunodeficiency, joint pain, limited mobility. Nursing interventions: antiretroviral therapy, pain management, mobility promotion, postoperative care. SLE, systemic lupus erythematosus. Causes: autoimmune response affecting multiple organs. Signs and symptoms: joint pain, skin rashes, organ involvement. Nursing interventions: symptomatic relief, immunosuppressive therapy, patient education. Osteoporosis. Causes: bone density reduction. Signs and symptoms: fractures, loss of height. Nursing interventions: calcium and vitamin D supplementation, fall prevention, weight-bearing exercises. Osteoarthritis. Causes: joint cartilage degeneration. Signs and symptoms: joint pain, stiffness. Nursing interventions: pain management, joint protection strategies, assistive devices. Cardiac problems. Dysrhythmias and interpretation. Causes: electrical conduction abnormalities. Signs and symptoms: irregular heartbeat, palpitations. Nursing interventions: monitor ECG, administer antiarrhythmics, assess for underlying causes. AFib, VTach, VFib. Causes: atrial fibrillation, ventricular tachycardia, ventricular fibrillation. Signs and symptoms: irregular heartbeat, chest pain, loss of consciousness. Nursing interventions: medication administration, defibrillation, cardioversion. STEMI and NSTEMI. Causes: myocardial infarction. Signs and symptoms: chest pain, shortness of breath. Nursing interventions: administer thrombolytics, monitor for complications. HF, heart failure. Causes: impaired cardiac function. Signs and symptoms: edema, dyspnea, fatigue. Nursing interventions: diuretics, ACE inhibitors, lifestyle modifications. Endocarditis, pericarditis. Causes: infection of heart valves, pericardium. Signs and symptoms: chest pain, fever, murmur. Nursing interventions: antibiotics, pain management, monitor cardiac function. Respiratory alterations: ABG interpretation, blunt chest trauma, pulmonary embolism, asthma, COPD. Causes: altered gas exchange, trauma, blood clot, chronic respiratory conditions. Signs and symptoms: dyspnea, chest pain, wheezing. Nursing interventions: oxygen therapy, chest physiotherapy, medication administration. Chronic acute neuroproblems: stroke, seizure, ICP monitoring. Causes: ischemic or hemorrhagic event, abnormal brain activity, increased intracranial pressure. Signs and symptoms: neurological deficits, seizures, altered consciousness. Nursing interventions: thrombolytics, antiepileptic drugs, ICP monitoring. TIA alteplase calculation. Causes: transient ischemic attack. Signs and symptoms: temporary neurological deficits. Nursing interventions: assess risk factors, administer alteplase, monitor for bleeding. Renal and urinary disorders. Ileostomy care, acute kidney failure, chronic kidney failure, dialysis. Causes: surgical diversion, decreased renal perfusion, long-term kidney dysfunction. Signs and symptoms: electrolyte imbalance, fluid retention, anuria. Nursing interventions: stoma care, fluid management, dialysis support. Renal surgical management. Causes: surgical intervention for renal conditions. Signs and symptoms: postoperative pain, altered kidney function. Nursing interventions: pain management, monitor renal function, postoperative care. Endocrine: various endocrine disorders. Causes: hormonal imbalances, tumor growth, autoimmune responses. Signs and symptoms: altered metabolism, fatigue, changes in body composition. Nursing interventions: hormone replacement therapy, symptom management, patient education. Aid 8. Case studies. Case study: Mrs. Johnson's complex medical presentation. Patient profile: Mrs. Johnson, a 65-year-old female with a history of hypertension, presents to the emergency department with complaints of sudden onset shortness of breath, chest pain, and leg swelling. Deep vein thrombosis, DVT. Background: Mrs. Johnson recently underwent hip replacement surgery. Signs and symptoms: unilateral leg swelling, tenderness, and pain. Rationale of treatment: ultrasound confirms the presence of a DVT in Mrs. Johnson's left leg. Anticoagulant therapy, e.g. heparin, is initiated to prevent further clot propagation and embolization. Compression stockings are applied to reduce edema and improve venous return. Pulmonary embolism, PE. Background: despite being on anticoagulant therapy, Mrs. Johnson's respiratory distress worsens. Signs and symptoms: acute onset of dyspnea, chest pain, and increased respiratory rate. Rationale of treatment: a CT pulmonary angiography confirms the presence of a pulmonary embolism. Thrombolytic therapy, e.g. alteplase, is administered to rapidly dissolve the clot, restoring blood flow to the lungs. Oxygen therapy and hemodynamic monitoring are initiated to support respiratory function. Congestive heart failure, CHF. Background: Mrs. Johnson has a history of hypertension and now presents with worsening dyspnea and fatigue. Signs and symptoms: bilateral lower extremity edema, jugular venous distension, crackles in the lungs. Rationale of treatment: echocardiography reveals impaired left ventricular function. Diuretics, e.g. furosemide, are prescribed to reduce fluid overload. ACE inhibitors, e.g. enalapril, are initiated to improve cardiac function and reduce afterload. Daily weight monitoring and dietary sodium restriction are recommended to manage fluid balance. Myocardial infarction, MI. Background: Mrs. Johnson complains of persistent chest pain and nausea. Signs and symptoms: ST segment elevation on ECG, elevated cardiac enzymes. Rationale of treatment: Mrs. Johnson is diagnosed with an acute ST elevation myocardial infarction, STEMI. Immediate percutaneous coronary intervention, PCI, is performed to restore blood flow to the occluded coronary artery. Dual antiplatelet therapy, aspirin and clopidogrel, is initiated to prevent further clot formation. Urinary tract infection, UTI. Background: Mrs. Johnson reports burning sensation during urination and increased frequency. Signs and symptoms: dysuria, urgency, cloudy urine, foul odor. Rationale of treatment: urinalysis confirms a urinary tract infection. Antibiotic therapy, e.g. ciprofloxacin, is prescribed to eradicate the infection. Increased fluid intake is recommended to flush bacteria from the urinary tract. Stroke. Background: Mrs. Johnson suddenly develops slurred speech and weakness on one side of her body. Signs and symptoms: facial droop, arm weakness, difficulty speaking. Rationale of treatment: a CT scan reveals an ischemic stroke. Thrombolytic therapy, e.g. alteplase, is administered within the narrow time window to dissolve the clot and improve cerebral blood flow. Physical therapy and speech therapy are initiated to promote functional recovery. Sepsis. Background: Mrs. Johnson, already hospitalized, develops a high fever, confusion, and hypotension. Signs and symptoms: tachycardia, hypotension, altered mental status. Rationale of treatment: blood cultures confirm sepsis. Broad-spectrum antibiotics, e.g. vancomycin and ceftriaxone, are administered to target the causative microorganisms. Intravenous fluids are given to restore circulating volume, and vasopressors are initiated to maintain blood pressure. Close monitoring of vital signs and laboratory parameters is essential for ongoing management. Conclusion: Mrs. Johnson's case highlights the interconnectedness of various medical conditions and the importance of prompt and targeted nursing interventions. The rationale for each treatment modality is based on the specific pathophysiology of the diagnosed condition, aiming to alleviate symptoms, address the underlying cause, and optimize patient outcomes. Continuing on, let's discuss the following topics: oncology, hematologic alterations, musculoskeletal, gastrointestinal alterations, hepatobiliary alterations. I. Oncology nursing as types of cancer, hematologic solid tumor, leukemia, stemming from abnormal blood cell production in the bone marrow, often resulting in an overabundance of immature white blood cells. Lymphomas, cancers affecting the lymphatic system, encompassing Hodgkin's and non-Hodgkin's lymphomas. Bone cancers include osteosarcoma and Ewing sarcoma originating in bone tissue. B. Therapy. 1. Radiation. Rationale: employed to target and eradicate cancer cells with ionizing radiation. Nursing considerations: focus on precise positioning, skin care, and patient education regarding potential side effects. 2. Surgery. Rationale: surgical removal of tumors and affected tissues. Nursing considerations: comprehensive preoperative and postoperative care, emphasizing pain management. 3. Chemotherapy. Rationale: utilizes drugs to target rapidly dividing cancer cells. Nursing considerations: vigilant monitoring for side effects and the implementation of strategies to manage chemotherapy-related symptoms. Or immunotherapy. Rationale: enhances the body's immune response against cancer cells. Nursing considerations: close monitoring for immune-related adverse events, patient education on potential side effects. C. Complications, oncologic emergencies. Examples: tumor lysis syndrome, neutropenic sepsis. Nursing interventions: prompt response, supportive care, and continuous monitoring for potential complications. D. Palliative care at end of life. Goals: emphasis on symptom management, psychological support, and enhancing overall quality of life. Nursing interventions: open communication, effective pain management, and providing holistic end-of-life care. Hematologic alterations. A. Heparin calculation. Rationale: anticoagulant used for preventing and treating thromboembolic events. Nursing considerations: precise dosage calculations, vigilant monitoring for signs of bleeding, and patient education on self-administration. B. Anemia. Types: iron deficiency anemia, pernicious anemia, and hemolytic anemia. Signs and symptoms: fatigue, pallor, shortness of breath. Nursing interventions: targeted treatment approaches including iron supplementation, blood transfusions, and nutritional counseling. C. Thrombocytopenia. Causes: reduced platelet production or increased destruction. Signs and symptoms: petechiae, bruising, bleeding. Nursing interventions: administering platelet transfusions, implementing bleeding precautions, and managing medications. D. Neutropenia. Causes: commonly a result of chemotherapy or bone marrow disorders. Signs and symptoms: increased susceptibility to infections. Nursing interventions: infection prevention strategies, meticulous monitoring for signs of infection, and potential use of growth factor therapy. E. Blood component therapy. Rationale: replacement of specific blood components such as platelets, plasma, and red blood cells. Nursing considerations: rigorous compatibility checks, continuous monitoring for transfusion reactions, and patient education. FDVT, deep vein thrombosis. Causes: prolonged immobility, hypercoagulable states. Signs and symptoms: leg swelling, pain, warmth. Nursing interventions: administration of anticoagulant therapy, application of compression stockings, and encouragement of ambulation. Musculoskeletal. Fractures, sprains, and strains. Fractures occur when bones break due to force or impact. Nursing considerations: immobilization, pain management, and potential surgical intervention. Sprains and strains result from overstretching or tearing of ligaments, sprains, or muscles, tendons, strains. Nursing considerations: RICE, rest, ice, compression, elevation, pain management, and rehabilitation. B. Osteomyelitis. Causes: bacterial infection of the bone. Nursing interventions: antibiotic therapy, wound care, and pain management. C. Low back pain, acute and chronic. Causes: strain, herniated discs, degenerative conditions. Nursing interventions: comprehensive pain management, physical therapy, and ergonomic education. D. Osteoporosis. Causes: decreased bone density. Nursing interventions: calcium and vitamin D supplementation, weight-bearing exercises, and fall prevention strategies. E. Amputations. Causes: trauma, vascular disease. Nursing interventions: preoperative and postoperative care, psychological support, and rehabilitation. F. Osteoarthritis. causes degeneration of joint cartilage. Nursing interventions, pain management, joint protection strategies, and assistance with adaptive devices. G. Gout, causes buildup of uric acid crystals in joints. Nursing interventions, medication management, dietary counseling, and pain management. IV, gastrointestinal alterations. A. Upper GI. 1. GERD, gastroesophageal reflux disease. Causes, lower esophageal sphincter dysfunction. Nursing interventions, lifestyle modifications, acid-reducing medications, and monitoring for complications. 2. PUD, peptic ulcer disease. Causes, H. pylori infection and NSAID use. Nursing interventions, antibiotic therapy, acid-reducing medications, and dietary counseling. 3. Gastritis. Causes, inflammation of the stomach lining. Nursing interventions, medication management, dietary modifications, and symptom relief. 4. Hiatal hernia. Causes, weakness in the diaphragm. Nursing interventions, lifestyle modifications, medication management, and potential surgical intervention. B. Lower GI. 1. Abdominal pain. Causes, diverse gastrointestinal conditions. Nursing interventions, pain assessment, medication management, and appropriate diagnostic tests. 2. Irritable bowel syndrome. Causes, altered bowel motility, visceral hypersensitivity. Nursing interventions, dietary modifications, stress management, and medication management. 3. Acute peritonitis. Causes, inflammation of the peritoneum. Nursing interventions, antibiotic therapy, pain management, and monitoring for complications. 4. Inflammatory bowel disease. Causes, chronic inflammation of the gastrointestinal tract. Nursing interventions, medication management, dietary counseling, and close monitoring for complications. 5. Obstruction. Causes, physical blockage of the bowel. Nursing interventions, NPO status, NG tube placement, and surgical intervention if necessary. 6. Diverticulosis, diverticulitis. Causes, formation and inflammation of diverticula. Nursing interventions, antibiotic therapy, dietary modifications, and monitoring for complications. 7. Ostomy. Causes, surgical creation of an opening in the abdomen. Nursing interventions, stoma care, patient education, and psychosocial support. 8. GI bleed. Causes, peptic ulcers, varices, malignancies. Nursing interventions, hemodynamic stabilization, blood transfusions, and diagnostic procedures. CGI complications. 1. Nausea, vomiting, diarrhea. Causes, various gastrointestinal conditions, chemotherapy. Nursing interventions, administration of antiemetic therapy, fluid and electrolyte replacement, and dietary modifications. 2. Constipation. Causes, decreased bowel motility, medications. Nursing interventions, establishment of a bowel regimen, fiber supplementation, and encouragement of fluid intake. 3. Anorexia. Causes, cancer, chemotherapy, psychological factors. Nursing interventions, nutritional support, appetite stimulants, and psychosocial support. V. Hepatobiliary alterations, ahepatitis and cirrhosis. Causes, viral infections, alcohol abuse. Nursing interventions, antiviral therapy for hepatitis, liver support measures, and lifestyle modifications. B. Acute chronic pancreatitis. Causes, gallstones, alcohol abuse. Nursing interventions, comprehensive pain management, enzyme replacement therapy, and dietary modifications. C. Gallbladder disease. Causes, gallstones, inflammation. Nursing interventions, consideration of cholecystectomy, pain management, and dietary modifications. Conclusion: this comprehensive lecture underscores the nuanced nursing considerations across diverse health conditions, providing specific insights into types of cancers, hematologic alterations, musculoskeletal issues, and gastrointestinal disorders. Tailoring nursing interventions to the unique characteristics of each condition is pivotal for optimizing patient outcomes and ensuring holistic care. As always, thank you for visiting, and don't forget to hit that like, subscribe, and notification bell to stay up to date on new content.